fellow Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And today I have a special guest with me here at the studio in our series where we introduce our expert speakers to our listeners. And with me today is Dr. Nicholas Embleton. Welcome, Dr. Embleton.
Thank you. Nice to meet you.
It is wonderful to have you here with me today, and we're going to chat about a presentation. You will be headlining our neonatal online conference this year, isn't that right? With our opening keynote here for us.
That's right, yes.
It's very exciting. And you have been with us at Gold here before, right? You have been with us a couple of years back, is it now?
Yeah, a couple of years back it was now. Yeah, I think so.
Right. And we are so excited to have you back here with us today. And you're back by popular demand. We got a lot of feedback from our listeners that they wanted you back. And we are so honored that you're back here with us and headlining our neonatal online conference this year. So thank you so much for that.
Yeah, well, thank you for inviting me.
And to our listeners here who have not yet had the pleasure to meet you or listen to you, can you introduce yourself a little bit? Tell us a little bit about yourself, your background.
Yeah, I'm a neonatologist in the UK, so I'm based in Newcastle, which is in the north of England, and I've been working in neonatology for more than 25 years now. So I started off my residency in neonatology when, in fact, I intended really to be a pediatrician, so I ended up in neonatology by accident, really. But I was lucky enough in the late 1990s to get involved in quite a lot of research around nutrition and feeding in preterm babies. And then I've been able to continue my interests in nutrition, but also get involved with different aspects, so looking particularly at necrotizing enterocolitis and being involved in some big trials and really trying to understand what's going on inside the guts of these preterm infants.
Right, absolutely. That is absolutely. I've read here that you are actually part of a very big study with over 5,000 infants in the UK. Is that correct?
Yeah, we've been lucky in the UK to have a number of collaborations. We have a very good sort of system for doing performing kind of research that allows us to collaborate with lots of different hospitals. So we've recently completed 2 trials, one of which was looking at the speed of increases in feeds. That was called the SIFT trial, and that involved about 60 or 70 hospitals in the UK. And then shortly following on from that, we did a trial looking at the benefits of giving extra lactoferrin into the milk feeds of preterm babies. So lactoferrin is a protein found in milk that is felt to have sort of anti-infective properties. And so these 2 trials combined recruited more than about 5,000 babies and involved a sort of collaboration with probably the 2 trials together of almost 100 hospitals. So this was a massive undertaking, and really we were kind of lucky to have such large collaboration of interested clinicians and nurses supporting us. So that's taken quite a lot of our time over the last few years. But certainly it's helped us get some really important information.
Absolutely, absolutely, and over 100 hospitals you mentioned there. That is absolutely fascinating, and I can only imagine the difference this will make, for the lives of neonates and families all over the world. Basically, the results of the research there. You mentioned that you've been involved in research on nutrition in neonates since the 1990s. Tell me about this. I feel like we're learning so much in the recent years, so much new information. How has it changed since the 90s? I mean, it must be almost 2 different worlds now since you started your research, right?
Yeah, I mean things have changed a lot. I mean certainly back in the 90s when you were practicing neonatology, the focus was very much on respiratory care and ventilation and these sorts of challenges. And of course, if babies were dying of their lung disease, they were not surviving to have some of the kind of nutritional complications that we see now. So as survival's improved over the last sort of 10, 20 years, we're now faced with the challenges of how to feed these very small and vulnerable babies. And as we've got better supporting the babies after operations for things like necrotizing enterocolitis, these babies have lots of complications because of short gut. So the population of babies is changing. And really the importance and the focus of the studies that people were doing in the 90s is very different to the sort of focus that we need to have now.
Right, absolutely. That makes a lot of sense. You're absolutely right. Younger and younger, premature babies are able to survive, and that changes absolutely the population of,
Yeah, yeah. I
and
mean,
also the
if we went back into the 90s, it was quite uncommon for us to have babies surviving at 24 weeks, and very few babies ever
right.
survive less than 24 weeks. But even today, as I sit here, we have 3 babies on the unit at the minute who were born at 23 weeks gestation,
Wow.
and our
Wow.
survival at 23 weeks in the last few years
Hmm.
is now over 60%.
Yeah.
So these babies are presenting challenges that we probably didn't really face that commonly back in the 90s.
Absolutely, absolutely. And you've been heavily involved in also research. We're learning, and this leads me to your topic you're presenting on. You're presenting on probiotics in preterm infants. We're learning so much about the microbiome, right, and the
Yeah,
gut. And so this is something that recently, more in the last few years, has become really, really a hot topic, hasn't it?
yeah. Well, I mean, I'll be honest. When I was doing the research in the 90s and then in the 2000s, nobody really had any idea what was happening with the importance of bacteria. We were pretty sort of unaware of the complexity of the gut and the different organisms. And of course, if you're not aware of these things, then you can't even begin to study them. So really, the big advances in the last sort of 10 years or so have come because of scientific, technical advances that have allowed us to
Hmm.
detect and find all these different bacteria. As I
Right.
say, like 10 years ago, we didn't know these things even existed. And really that's
Right.
helped us understand why, maybe things like probiotics or lactoferrin either work or don't work, helped us understand really some of the mechanisms by which breast milk might be exerting its benefits. So this is an absolute explosion of scientific interest now, and it's
Yeah.
really kind of quite difficult to keep up. But some of the talk I will kind of try and give a background to the complexity of the microbiome, just explain to people kind of what's in there and how do we
Hmm.
study it and what it means and the kind of relevance to preterm babies, along with the role of probiotics perhaps.
Absolutely, yes, and it is absolutely fascinating and wonderful to see also, we're learning a lot about the breast milk, how wonderful it is for these preterm babies, right? I mean, for all the wonderful components that are in breast milk,
Yeah,
and that
I
we,
mean
yeah.
it is totally amazing, and I'll be the first to admit that I had no idea of the complexity of this when I was starting my research back in the 90s, and really, even what I know now, I'm sort of amazed at how little I knew about this stuff even just a few years ago, despite the fact that all of my research interests are in nutrition. So breast milk is really amazingly complex, and
Yeah.
we need to sort of, I guess, better understand how it's doing this so that we can help those babies who still run into problems despite getting mum's breast milk. Because, wonderful as breast milk is, it certainly reduces the risk of some of these nasty diseases. We still know that some of the babies who only ever get mum's breast milk still develop neck or sepsis. And we need to understand, why is it in those babies that it's maybe not having the same effect that it has in other babies.
Hmm. That's interesting, very interesting. And so, yeah, you will, as you mentioned, you will be presenting on probiotics. Probiotics is also become one of those. We're learning a lot about the microbiome. It's getting almost mainstream now. We see a lot on social media, and as healthcare providers, we get a lot of questions from parents saying like, what do you think about they've heard maybe something about how important the microbiome is for the newborn or for the baby. Maybe they had a C-section birth and they are now worried that the baby didn't get all the good, elements that maybe the baby should have gotten through a vaginal birth. And the first question they ask is, can we give probiotics? I know this is a little bit different on what you will be presenting on, but it is such an important topic in general because I think we all think, oh, probiotics are wonderful, but
Yeah.
it is kind of a very complex issue. Not every, not, the probiotics in a neonate or in a preterm baby might be very different from what an adult or what, or an older child would need to get. So tell us a little bit about that.
Yeah, I mean, I think that there's no doubt that the availability of probiotics, you can just go down to your local food store and buy them,
Right.
has, focused everybody's attention on the importance of the gut, and none of us would have known about bacteria in the gut in years gone by. But, probiotics have made people think about that. And you're right, there's loads of products out there marketed and aimed at all kinds of people. And it's a big industry. People are making big money out of producing these things. But of course, the way that these work is really important for us to understand. And just because a probiotic might be healthy or helpful in an adult in some way, there's no reason why that should also work in an infant, because the pattern of germs in our guts change over time. So what works in an adult might not work in a child. What works in a child may not work in an infant, and what works in a term infant may not work in a preterm infant. Really, that's the problem we have. That people are looking for simple solutions to complex problems. And anybody who's looked after premature babies and tried to feed and nourish them and give them TPN and milk and everything, everybody knows this is complex. And the idea that somehow someone's going to produce a single probiotic that's going to come along and solve these problems is fanciful. It's just not going to be the case. So I think that people have hoped that maybe there are simple answers to these complex problems, but that's definitely not true. And as I say, some of the lecture is really going to try and explain to people the complexity of the gut and the bacteria and feeding, so that we can understand better how the probiotics may or may not be working and the risks or benefits associated with them. So really what I'm trying to do is give people some education and some background knowledge so that they can make their own decisions about what's right, because certainly there isn't a sort of one solution fits all in this sort of topic.
Absolutely. Thank you for that. And last question before I let you go here today, and we appreciate your time you're spending here with us. So what is it you hope that our listeners will take away from the presentation? As you mentioned, you want to educate, but is there something maybe else you feel like that you really hope they're getting too?
I want people, to, I suppose, just kind of marvel at the complexity of what's going on in the gut. In the past, I think we just assumed that the gut was this sort of inert tube, and you tip milk in and you suck out the nutrients and you produce some stool at the other end. And I want people to kind of marvel at the complexity of what's actually going on in there. And then when it comes to probiotics, I want people to have an appreciation that there really have been quite a lot of studies done, and that many of them suggest a benefit. But of course, there are problems with the interpretation of every trial. And this is certainly true in probiotics. And really what I want to encourage people to do is to make the decisions that best suit their own environment and the populations and NICUs that they work in. Because what works for us in Newcastle may not work for somebody with a different type of baby in a different setting. So, we can't answer all the questions, but at least we can arm people with a better way of approaching things and perhaps be a little bit more systematic in making these decisions. But also to recognize that, okay, there may be theoretical risks and there may be more to learn, but if you are the parent of a baby with with a small baby on the NICU, what is it you would want for your baby? Would you really decide that you wouldn't give probiotics because you weren't absolutely sure that the evidence was as strong, or would you look at these products and go, they look pretty safe and they might do a good thing, yes, that's what I would want for my baby. So I just want to arm people with the information to have a more thoughtful discussion about what's right, rather than necessarily telling people what they should do in their own units.
Well, thank you so much. I am very much looking forward to this presentation. There will be so much good information. I can't wait for it. And thank you so much, Dr. Embleton, for spending time here chatting with me today on your background and on the presentation here for us.
Okay, you're welcome.
And the presentation, Probiotics in Preterm Infant, is our opening keynote here at the Gold Neonatal Conference, online conference here at Gold. And Dr. Embleton will be presenting twice on June 3rd. And to our listeners now, if you want to find more about this fascinating presentation, that is actually also open access. So it is free for you to watch and sign up for and share with colleagues and friends or anybody in the field who might have an interest in that. Go to goldneonatal.com. You find more information on the presentation there and also the other presentations in the conference, and you find also out when it is held in your time zone. We are an international conference. Our listeners, of course, are all over the globe, so you might be in a different time zone. But you will find the information on our website at goldneonatal.com. So thank you again, Dr. Nicholas Embleton, for spending time here with us today. And thank you to all our listeners here today. Bye-bye for now.